brain stroke and its radiological workup. We have two important modalities for the assessment of stroke in brain. Number one is CT and number two is MRI. When we compare these two modalities, we say that MR is best modality as compared to CT, but considering viva examination for final year, we usually see that examiners present CT, so we will stress on CT images in present discussion. So we have to use either CT or MRI, but in present discussion we will use CT examination. Whenever patient comes with the right or left hemiplegia or any focal neurological deficit, we will proceed with the help of CT, and main aim is to differentiate hemorrhage from ischemia so that we can proceed with appropriate treatment, because the treatment for the ischemia is different from that of hemorrhage. After this, we will proceed for assessment of carotid arteries. Here in carotid arteries, we have to rule out atheromatous changes, and if atheromatous plaques are present, then this is our duty to measure the luminal nerving. If luminal nerving is above 70%, then patient needs intervention, and if luminal nerving is below 70%, then there will be a medical treatment. So for assessment of the carotid arteries, we use carotid Doppler or conventional angiography. We can also proceed with the help of CT and MR angiography. Here in this lecture, we will see multiple examples of carotid Doppler, conventional angio, and CT and MR angio. And after assessment of the carotid arteries, we have to rule out cardiac valves vegetation with the help of echocardiography. So basically we have three targets. Number one, we have to see brain either with the help of CT or MRI to differentiate hemorrhage from ischemia so that we could proceed with the appropriate treatment. Second one is we have to rule out any source of emboli either from carotid arteries or from heart. So for assessment of the carotid arteries, we can use carotid Doppler, we can proceed with the help of conventional angiography, or we can use CT or MR angiography. Similarly, we have to see cardiac vegetations with the help of echocardiography. So in first slide, we see two CT patients. Here you can see hemorrhage, which is high density, and on other side we can see a low density ischemia. So the main difference between ischemia and hemorrhage on CT is that hemorrhage would be high density and ischemia would be of low density. So in this case, this is acute ischemic insult in a right temporoparietal lobe in the distribution of right MCA, that is middle cerebral artery. So patient will be presenting with the weakness of left half of the body because there is involvement of right side. This is another example where we can see a large low density area in right temporoparietal lobe, and this is again another example for acute ischemic insult in the distribution of the right MCA, and patient presented with the history of weakness of left half of the body. Another example here, this area which is marked with the red marker is low density area in right periventricular region. Again an example of acute ischemic changes in the brain. Another example of low density area in right temporoparietal lobe favoring acute ischemic insult in the distribution of the right MCA we have already seen. Here we can see that there is low density area involving medial portion of right occipital lobe. So this region is the distribution of right posterior cerebral artery. Here we have another example where we can see low density area involving left cerebellar hemisphere. So we have seen multiple examples of ischemic changes in the brain, and we have also discussed that the difference between ischemia and hemorrhage according to the density of lesion. Now we have to see carotid vessels initially with the help of carotid Doppler. Here this is a grayscale ultrasound where we can see common carotid artery, and this is internal jugular vein, and this portion is internal carotid artery, and this one is external carotid artery. And this is a normal examination, and here we see that this soft tissue is basically plaque in proximal most portion of internal carotid artery, and this one is the common carotid artery. Common carotid artery, external carotid and internal carotid artery, and here we can see this is calcified plaque. This is an example of carotid Doppler. We can see common carotid and internal carotid and external carotid arteries. Here we can see this is common carotid, external and internal carotid artery, and this hypoechoic or black area is basically plaque. This is atheromatous plaque, and this causes narrowing in this portion. Another example we can see, this is common carotid artery, this is internal and external carotid artery, and here we can see this is plaque. You can see a hypoechoic area or black area which is causing narrowing of the vessel in this region. Here we have another example where there is plaque on both sides of the artery causing luminal nerving. Another example is we can proceed carotids with the help of conventional angiography. Here we have normal conventional angiogram. This is common carotid, and this is internal carotid artery, and this one is the external carotid artery. This is the negative image of conventional angiography, where we can see this is common carotid artery, external carotid artery and its branches, and this one is proximal portion of internal carotid artery, where we can see severe stenosis in this region because of atheromatous changes. This is another example where we can see common carotid artery, and this one is the external and this is internal carotid artery. Severe stenosis is appreciated because of atheromatous changes in this junction. Here we have CT angiography. This is angiography through CT, and we can see normal anatomy which is marked. You can clearly read it, and this is basically 3D surface rendering image for arch of aorta and common carotid arteries, vertebral arteries and arteries in the brain. That is, you can see circle of Willis over here and vertebral basilar arteries. Here we have some pathologies. This yellow arrow shows circumferential atheromatous changes, while this tiny high density dot represents narrowed lumen on X-ray images. And here in this image, this is a coronal image where we can see this is calcified atheromatous plaque causing luminal nerving. This is right internal carotid artery. This one is the right common carotid artery, and here you can see right external carotid artery with its branches. Here we have another example of the CT angio where we can see this is a common carotid artery and this one is the internal carotid artery, and here there is significant nerving because of atheromatous changes in proximal portion. Again, this is a 3D examination of carotid angio through CT. These are vertebral arteries, and here we can see there is significant nerving in proximal portion of right internal carotid artery. while there is moderate nerving in proximal portion of the left internal carotid artery. So these areas or nerving are basically due to erythematous plaques in these areas. Here we have MR angiography. Few examples. We can see there is non-visualization of proximal segment of the left internal carotid artery because of severe stenosis in this region. Mild to moderate degree of nerving of right external carotid artery is also identified, but internal carotid artery appears normal on right side. Another example, we can see very tight stenosis noted in proximal portion of the left internal carotid artery. Another example, we can see focal stenosis noted in proximal portion of the left internal carotid artery and mid portion of the left vertebral artery. This is a magnified view. We can see vertebral artery with stenosis in this region. Now we have covered examples of assessment of carotid vessels with the help of different imaging modalities. We can repeat it. That is, number 1, Doppler study. Number 2, conventional angiography. Number 3, CT angiography. And number 4, MR angiography. Now for the treatment purpose, this is schematic diagram. We can see erythematous changes in proximal portion of internal carotid artery, and here in this case, whenever luminal nerving is more than 70%, treatment is surgical in the shape of end arterectomy. Here incision is made in the region of bifurcation, and a yellow erythematous plaque is removed, and then incision is stitched. And here you can see this is a clean lumen, and in this region you can see a yellow plaque causing luminal nerving. So this procedure is called end arterectomy of the carotid artery. Here you can also see again the incision is made at the level of bifurcation of the common carotid artery, and a erythematous plaque is removed. Here another type of intervention is that we can see a erythematous plaque, and here catheter is passed containing stent in it, and this stent is expanded and normal lumen is maintained with this. Here we have an example where there is tight stenosis in terminal portion of the common carotid artery and proximal most portions of both internal and external carotid arteries. And here we can see the stent is passed in stenotic segment, and its lumen is again maintained, while in distal portion of the internal carotid artery, filter is passed to save brain from any emboli during process. Now we have to proceed on last portion of this discussion, which is assessment of cardiac vegetation with the help of echocardiography. Here we have a few examples, schematic diagrams showing multiple nodules in mitral valve, suggesting mitral valve vegetations. And this is the echocardiogram showing nodules, echogenic nodule in mitral valve. So these vegetation dislodges to the brain and cause ischemic changes. Another schematic example where we can see multiple conglomerated nodules suggesting vegetation in the mitral valve. This is another example where we can see mitral valve vegetation. Another example where lobulated nodular surface of the mitral valve is seen, suggesting mitral valve vegetation. This is another example of nodular appearances of mitral valve vegetation. Another example of mitral valve vegetation. This is last image where we can see a nodular appearance of undersurface of the valve, suggesting valvular vegetation. So we have seen carotid and we have seen cardiac valves as a further workup in the assessment of cause of ischemic changes in the brain. Thank you.